Can trauma cause ADHD? Exploring the relationship between trauma and attention deficit, hyperactivity disorder, attention deficit, hyperactivity disorder, ADHD, is a neurodevelopmental disorder characterized by symptoms of inattention, impulsivity, and hyperactivity. While genetic and environmental factors are known to contribute to the development of ADHD, emerging research suggests that exposure to trauma during childhood may also play a role in the onset and manifestation of this condition. Trauma, defined as a deeply distressing or disturbing experience, can encompass a wide range of events, including physical or emotional abuse, neglect, accidents, natural disasters, or witnessing violence. When children experience trauma, especially during critical periods of brain development, it can have profound and lasting effects on their cognitive, emotional, and behavioral functioning. Here are several ways in which trauma may contribute to the development or exacerbation of ADHD. Impact on brain structure and function. Trauma can disrupt the development of key brain regions involved in attention, impulse control, and executive functioning, which are also implicated in ADHD. Chronic exposure to stress hormones such as cortisol can alter the structure and function of the prefrontal cortex and other brain regions responsible for regulating attention and behavior. 2. Dysregulation of neurotransmitters. Trauma can dysregulate neurotransmitter systems, such as dopamine and norepinephrine, which play a crucial role in ADHD. Disruptions in these neurotransmitter systems can impair attention, arousal, and impulse control, contributing to ADHD-like symptoms. 3. Co-occurrence of symptoms. Children who experience trauma may exhibit symptoms that overlap with those of ADHD, such as difficulty concentrating, impulsivity, and restlessness. These symptoms may be misattributed to ADHD, leading to a diagnosis, even if the underlying cause is trauma-related. 4. Complex interplay of factors. Trauma rarely occurs in isolation, and its effects are often intertwined with other environmental and genetic factors that contribute to ADHD. Factors such as family dysfunction, socioeconomic adversity, and prenatal exposure to substances can further exacerbate the impact of trauma on neurodevelopment. 5. Increased risk of comorbid conditions. Children who experience trauma are at a higher risk of developing comorbid mental health conditions, such as anxiety, depression, and disruptive behavior disorders, which frequently co-occur with ADHD. The presence of these additional challenges can complicate the diagnostic process and treatment planning. It's important to note that not all the people who experience trauma will develop ADHD, and the relationship between trauma and ADHD is complex and multifaceted. Additionally, ADHD is a heterogeneous disorder with diverse underlying causes and presentations, further complicating our understanding of its etiology. Early intervention and trauma-informed care are crucial for supporting children who have experienced trauma, whether or not they receive a diagnosis of ADHD. By addressing the underlying trauma and providing appropriate therapeutic interventions, such as trauma-focused therapy, cognitive behavioral therapy, and supportive services, we can help mitigate the long-term effects of trauma and promote healthy development. In conclusion, while trauma may contribute to the development or exacerbation of ADHD in some people, it is just one of many factors that influence the manifestation of this complex disorder. By understanding the relationship between trauma and ADHD and adopting a holistic approach to assessment and treatment, we can better support the needs of children and adolescents affected by these challenges.